Hey everyone, welcome back to the deep dive. We've got a really big one for you today.
Yeah, this is a big one.
We're diving into something that could have a major impact on all of us here in the Golden State.
Big time.
It's all about those proposed federal funding cuts that have been making headlines. We're talking a deep, deep dive into what's on the table, what it could mean for California, and of course, what it could mean for you.
That's right.
So to make sure we're covering all the bases we've pulled together, I think a pretty impressive stack of sources.
Yeah, absolutely.
We've got reports from the California Budget and Policy Center, statements and warnings from the American Hospital Association, analyses from the Center for American Progress, some good reporting from CBS News, and even some projections about what a second Trump term could look like.
Wow, that is a lot.
It is a lot.
A lot to unpack there.
It is, but that's our mission today. We're going to cut through all that noise, distill those key takeaways, and really try to understand the potential impact, not just on a state level, but on a personal level, your community, maybe even your own family.
Right, because this could really touch a lot of different aspects of life here in California.
Absolutely.
Okay,
So first things first, let's set the stage. When we talk about these federal funding cuts, what exactly are we talking about? What's the big picture here?
so at the heart of it, you've got a series of proposals put forward by Republicans in Congress.
Right.
And their aim is pretty clear-cut. Significantly reduce federal spending. Now, we're talking at least $1.5 trillion in cuts over the next decade.
Trillion with the T.
Trillion with a T, yeah. And some folks are even floating the idea of going even deeper, potentially more cuts to offset those big $4.5 trillion tax cuts that are also being talked about.
Wow. So we're not just talking about abstract numbers here. This is real money with potential real-world impacts.
Absolutely.
So how exactly are these cuts being considered? What's the process in Washington?
The main tool they're using is something called budget reconciliation.
Okay, budget reconciliation. That sounds kind of complicated.
It can be. But think of it as this special set of rules that Congress can use to fast-track certain budget bills.
Okay.
So normally in the Senate, you need 60 votes to pass something important, right, to overcome any opposition. But with reconciliation, they only need a simple majority, 51 votes.
So it makes it easier to push through big changes, like these massive spending cuts.
Exactly. It streamlines things. And we're actually seeing this process play out right now. The House of Representatives already passed its own budget resolution, and that lays out the framework for these proposed cuts.
Okay.
The Senate's also passed their own version, although, there are some differences. They're looking at maybe more moderate spending levels, which means potentially smaller cuts. But here's the key thing. Both the House and the Senate, they need to come together and agree on a single unified budget resolution before any of this can actually move forward.
So it's like a two-pronged attack.
Yeah, you could say that. They're approaching it from different angles, but the end goal, the reduction in spending, that's shared.
So what's driving all of this? What's the bigger picture motivation behind these proposed cuts?
Well, from what we're seeing in our sources, these proposals are very much tied to President Trump's agenda.
Okay.
It's about his priorities, like strengthening border security, boosting defense spending, changing energy policy, and of course, implementing those big tax cuts we mentioned earlier.
Right. So it's all part of a broader vision, you could say.
Absolutely. And they frame it around reducing the national debt.
Yeah.
Reshaping what the federal government should and shouldn't be involved in.
Okay, but it's not just about abstract policy, is it? I mean, we're already seeing real people raising real concerns about how this could affect them.
Oh, absolutely.
In fact, we have a statement here from Rick Pollock. He's the head of the American Hospital Association, and he's been pretty vocal about it.
Yeah, he has.
He's urging lawmakers to protect Medicaid, that program that provides health care to millions and millions of Americans.
Including a lot of folks right here in California.
Exactly. And he's really worried about how those proposed cuts could harm people who rely on those services.
Yeah, his concern is a real reminder that these aren't just numbers on a spreadsheet. We're talking about real people's lives.
Right. Real health care.
Real access to care.
Okay, so that's the national picture. Let's bring it home to California. What could these federal funding cuts mean for our state budget?
Well, buckle up, because this is where it gets real for us Californians.
Okay.
The California Budget and Policy Center, they paint a pretty clear picture. Federal funds make up a huge chunk of California's budget, over 1/3 to be precise. That's more than 30%.
Wow, more than a third.
More than a third. We're talking about roughly $170 billion in federal money coming into California each year. And you know what a big chunk of that goes to?
I'm guessing healthcare.
You got it, Medi-Cal.
Our version of Medicaid.
Exactly. Medical provides health care to over 14 million Californians. That's a lot of people relying on that program.
That's a lot of people.
Yeah.
So if the feds cut funding, it sounds like medical would be right on the front lines feeling the impact.
You hit the nail on the head. The Budget and Policy Center estimates that those Republican proposals to slash Medicaid, those could mean anywhere from $10 to $20 billion less in federal funding for California, maybe even more.
10 to 20 billion.
10 to 20 billion, and they call that a massive budget hole.
Yeah, I'd say so.
A hole that big, that's not something you just patch up easily.
And I imagine that would trigger some serious ripple effects.
Oh, absolutely. We're talking tough choices for state leaders.
Okay.
Potentially painful spending cuts across all kinds of state services.
Not just healthcare.
Nope, not just healthcare. Education, social services, infrastructure, pretty much anything Californians rely on could be on the chopping block.
That's a pretty daunting prospect. So let's dig into some of those specific services that could be at risk. Let's start with Medi-Cal. We've got over 14 million Californians depending on that program for their health care. If federal funding is slashed, what could that actually look like? What could that mean for those folks?
The Center for American Progress, they took a look at the House budget resolution and came up with some numbers, national numbers, but there's still a big warning sign.
Okay.
They estimate that if those $880 billion in Medicaid cuts go through, 15.9 million people across the country could lose their health coverage. That's huge. Now, we don't have California-specific numbers from our sources, but just imagine what a $10 to $20 billion reduction in federal medical funding could do here.
Yeah, it wouldn't be good.
Not good at all.
Yeah.
We could be looking at tighter eligibility rules, maybe cutting back on certain services covered, or even paying doctors and hospitals less, making it harder for people to actually find the care they need.
So it's not just about the money. It's about access to care.
Exactly. It's about whether you can actually get the medical attention you need when you need it.
And we can't forget about all those other essential programs that help vulnerable Californians, right?
Absolutely. The Budget and Policy Center highlights a whole bunch of them.
Okay, like what?
Well, for starters, there's SNAP, the Food Assistance Program. We call it CalFresh here in California.
Right.
It helps families put food on the table. Now, our sources don't give us exact dollar figures for how much CalFresh could be cut in the coming year, but any serious reduction in federal support would be a direct hit to, well, hundreds of thousands of families and individuals who rely on it. I mean, just look at the numbers. Between July 2023 and April 2024, we had a massive amount of people depending on CalFresh every single month.
Wow. So cuts there would be felt across a lot of communities.
For sure, a lot of families would feel the pinch.
And what about seniors and folks with disabilities, people who often live on fixed incomes?
They rely on programs like Supplemental Security Income, SSI, and State Supplementary Payment, SSP. Those help them make ends meet. Now, again, we don't have exact numbers for the proposed cuts from our sources, but we do know that a substantial amount of federal money went to support those grants in the last fiscal year.
Okay.
And in 2023, we had a huge number of people in California receiving SSI.
Right.
So any cuts there, that's directly impacting their ability to, to afford basic necessities.
To live, really.
Yeah, to live with dignity. And then there are all the families with young children.
Those are the folks who need the most help, right?
They're the future, right? We got to invest in them. And we've got programs like childcare and development programs, Head Start, Early Head Start, all these amazing programs that receive federal funding and are crucial for California families.
Right.
Our sources show us the funding levels from various state departments, and the enrollment numbers speak for themselves. I mean, just in October 2023, there were tons of kids, from newborns to 12-year-olds, enrolled in childcare programs. And then you've got Head Start and Early Head Start. The 2023-2024 data shows how many families rely on those. But if those federal dollars are cut, it could limit access to quality early learning and care, the kind of stuff that so many working families in California absolutely depend on.
Like pulling the rug out from under them.
It really is.
Yeah.
And then you can't forget about programs like CalWorks, those cash assistance programs that are literally a lifeline for families struggling to get by.
Yeah, those are crucial.
Absolutely. And you can see it in the numbers, those 2023-24 fiscal year estimates for federal funding. We're talking a significant amount of money going to support families in need. And between July and November 2023, a huge number of Californians, both adults and children, were relying on CalWORKs to put food on the table, keep a roof over their heads.
Right, those are families trying to get back on their feet.
Exactly. And cutting federal support could make that climb even steeper.
And finally, we can't forget about those Californians facing housing insecurity or homelessness. I mean, that's a crisis we're all too familiar with here.
It's a huge issue. And again, federal funding plays a big role in trying to address it. We're talking about programs that help provide shelter, support services, all that stuff. We have projections for how much federal money is slated to go to those programs in 2025-26. And the California statewide housing plan, it makes it very clear that federal support is absolutely essential to tackling this crisis.
So any cuts there would really set us back.
Oh, absolutely. It would make it even harder to help those individuals and families who are already struggling.
So we've covered a lot of ground here. We've talked about how these cuts could impact healthcare, food assistance, those living on fixed incomes, families with young children, folks struggling with housing. I mean, the list goes on.
There's a lot to take in.
It is. And it doesn't stop there. What about the impact on education, from kindergarten all the way through college?
That's another area where California could feel the pain.
Okay.
Both K-12 schools and higher education institutions, they rely on federal funding. For K-12, we're talking about potential cuts to all sorts of federal grant programs, the ones that support everything from special education to programs for low-income students. And there's even talk of diverting some of that federal money to private schools.
Wow.
Yeah. And the numbers are pretty eye-opening. We have those 2025-26 projections for how much federal money is supposed to go to K-12. And when you consider that we had millions of kids in California's public schools during the 2023-24 school year, even seemingly small percentage cuts, those could add up to big impacts in classrooms across the state.
Yeah, that trickles down to the kids, to the teachers, to everyone.
Exactly. And when it comes to higher education, well, the Budget and Policy Center, they call it particularly vulnerable to federal funding cuts.
And that makes sense, right? I mean, college is already so expensive.
It is. And these cuts could make it even harder to afford.
Okay, so what are we looking at specifically?
Well, we've got projected federal funding amounts for 2025-26 for all the big players. California community colleges, the CSU system, and the UC system. Hundreds of thousands of students rely on those institutions. You just look at the fall 2023 enrollment numbers, it's massive.
Yeah.
And if they cut federal grant programs, research funding, overall support, it could have a ripple effect on access, on affordability, on the quality of education.
So it's not just about the individuals who rely on these programs, it's about the institutions themselves.
It's the whole ecosystem.
And it sounds like these cuts wouldn't just affect individuals and state agencies. What about our local governments, our counties and cities?
That's another piece of the puzzle, and it's a big one. Counties, cities, special districts, all those local governments, they use federal funding for a lot of stuff.
Right.
From public health programs to infrastructure projects, you name it. And counties in particular, they're often the ones on the ground delivering those health and safety net programs.
Right.
And guess what? A lot of the money for those programs comes straight from the federal government.
So cutting those funds would really hamstring them.
It would, and we're already hearing concerns from county officials about the impact of federal funding freezes and these proposed cuts. Those would just amplify those concerns. I mean, in the last fiscal year alone, 2022-23, counties, cities, special districts here in California, they got a massive amount of federal funding. And the California State Association of Counties, they spell it out pretty clearly. Counties are responsible for a lot. Public safety, health, social services, infrastructure, the list goes on and on. And a lot of those services, they rely on federal dollars.
So we're talking a potential domino effect.
Yeah.
Cuts at the federal level could trigger a whole cascade of problems at the local level.
That's exactly it. It's all interconnected.
Okay, so we've talked about the broad strokes, the potential impact on all these different areas. Let's zoom in a bit and look at the actual Republican House budget resolution. Are there any specific clues in there about where those cuts might actually come from?
Well, there's one part that really stands out. The resolution specifically instructs the House Energy and Commerce Committee to find at least $880 billion in spending cuts between now and 2034.
That's a huge number.
It is. And here's the thing. That committee, they're the ones who oversee the Medicaid program. So a lot of folks are reading between the lines and saying that a big chunk of those cuts, they're probably going to target Medicaid.
So that's where they're going to try to find those savings.
That's what a lot of folks are thinking.
Okay, but $880 billion, that's a national figure. What does that look like on a more local level, say, per per congressional district?
Well, the Center for American Progress, they crunched the numbers, and their estimates are pretty stark.
Okay.
They say that the average congressional district could lose about $2 billion in federal funding over those 9 years, just from Medicaid cuts.
$2 billion per district. That's a lot of money.
It is. And they also project that all these cuts nationwide could lead to something like 15.9 million people losing their Medicaid coverage.
Or their CHIP coverage, right?
Yeah, the Children's Health Insurance Program.
That's a lot of people losing access to health care. Are there any specific examples, maybe even here in California, of districts that could be especially hard hit by these proposed Medicaid cuts?
Yeah, they point to districts with lots of Medicaid and CHIP enrollees. Those would be particularly vulnerable.
Okay.
For example, California's 22nd Congressional District, they estimate that could lose nearly $5 billion in federal funding over 9 years.
Wow, $5 billion.
$5 billion. And a lot of people in that district could lose their coverage, too.
So it wouldn't just be abstract, it would be real people losing real health care.
Exactly. That's the human cost of these cuts.
So let's say these Medicaid cuts do go through.
Mm-hmm.
How might they actually be implemented? What kind of changes are we talking about?
Well, there are a couple of main mechanisms being floated. One is tougher work requirements. So basically, to qualify for Medicaid, you'd have to prove that you're working a certain number of hours or looking for work.
Oh, yeah.
The other is a reduction in what's called the Federal Medical Assistance Percentage, or FMAP for short.
Okay, FMAP, what's that?
Basically, it's the percentage of a state's Medicaid costs that the federal government covers. So right now, the feds pick up a big chunk of the tab. But if they lower that percentage, California would have to pay more.
And that would put a huge strain on our state budget.
Absolutely. We'd be on the hook for billions of dollars more.
So what would California do? What options would we have?
Well, it wouldn't be pretty. We might have to raise state taxes, which nobody wants to do. Or we might have to make it harder to qualify for Medi-Cal, tighten up those eligibility requirements. Or we could cut back on the services that Medi-Cal covers, which would mean people wouldn't get the same level of care. And then there's the option of paying doctors and hospitals less, which could make it harder to find providers who are willing to accept medical patients.
So it's a lose-lose situation for a lot of Californians.
It really is. They'd either lose coverage altogether or they'd have a harder time getting the care they need.
Okay, let's step back for a minute and talk about the political context. What are the Republicans in Congress saying to justify these cuts? What's their rationale?
Well, according to our sources, they have a couple of main arguments. First, they say these spending cuts are necessary to pay for those big tax cuts they've been pushing through, the ones that mainly benefit corporations and wealthy individuals.
Right.
They argue that we need to cut spending to offset the cost of those tax cuts.
Okay.
And their second argument is that these cuts are needed to get the national debt under control. They say it's about fiscal responsibility.
So they're framing it as a necessary evil.
Right. But of course, not everyone agrees with that logic. Democrats and others who are concerned about these cuts, they have some pretty strong counterarguments.
Okay, like what?
Well, they say these cuts would hit the most vulnerable people the hardest. The people who rely on those federal programs the most, for healthcare, food, housing, all those essential needs. They're worried about those folks falling through the cracks.
It's about priorities, isn't it?
It is. And they also question those economic projections that the Republicans are using, the ones that say these tax cuts will magically boost the economy enough to pay for themselves and offset the deficit. They think those projections are too rosy and that these cuts could actually end up making the deficit worse, all while hurting people who are already struggling.
So they're skeptical of the whole premise.
Exactly. And they're worried about the potential consequences, both for the economy and for everyday people.
Now, we heard earlier about the concerns from the American Hospital Association about potential Medicaid cuts. What are Republican leaders saying to address those concerns?
Well, House Speaker Mike Johnson, he's been saying that any cuts to Medicaid, they'd be laser focused on getting rid of waste and abuse.
Okay.
They say it's about making the program more efficient, not about cutting benefits. Some other Republicans, they've even said that people wouldn't see any actual cuts to their benefits. But of course, the folks who oppose these cuts, they're not buying it. They just don't see how you can cut that much money, $880 billion, without it impacting the services that people rely on.
Right.
They just don't see how that math works out.
It's like saying you could lose weight without changing your diet or exercise.
Pretty much. It's a tough sell.
Now, we talked about budget reconciliation earlier, how it's being used to push these cuts through. Why is that so significant?
It's all about the numbers in the Senate.
Okay.
Normally you need 60 votes to pass most things in the Senate, but with reconciliation, you only need 51. So basically, it lets the Republicans bypass the Democrats and push these cuts through without needing their support.
So it's a way to get around the usual rules of the game.
You could say that. It gives them a lot more power.
But there are some rules with reconciliation, right?
Right.
It's not a free-for-all.
Right. There are some limits. And one of the big ones is that whatever they pass through reconciliation, it has to be deficit neutral.
Okay, deficit neutral.
So basically, it can't add to the national debt. And that's why those economic projections are so important to the Republicans. They're banking on those projections to show that their tax cuts will boost the economy enough to pay for themselves and also cover the cost of these spending cuts.
So it's a bit of a gamble, isn't it?
It is. And the critics say it's a gamble that could backfire big time. They say those projections are too optimistic, that the cuts could actually make the deficit worse, and that millions of Americans could be left without the support they need.
And a lot of those Americans are right here in California.
That's right. We're a big state with a lot of people who rely on these federal programs.
Okay, so we've talked about the proposed cuts, the process, the politics, but our sources also give us some interesting insights into President Trump's second term and how that might play into all of this.
Yeah, it's definitely relevant.
So what can you tell us about that connection?
Well, the California Budget and Policy Center, they remind us that Trump already tried to cut spending during his first term.
Oh yeah, the funding freeze.
Exactly. But that ran into some legal trouble and was eventually blocked.
Okay.
But now there's this thing called Project 2025.
Project 2025.
It's basically a blueprint put together by conservative groups. They outline all these goals for a second Trump term, like restructuring of federal agencies, shifting policies, and a big part of that is reducing federal spending.
So these proposed cuts in Congress, they could be part of the bigger, longer-term plan.
It's definitely a possibility, and there are some other hints, too. They had to pass a temporary funding bill last year to avoid a government shutdown, remember?
Yeah.
Well, the analysis says that Republicans want to go even further and make those cuts permanent. And then there are Trump's tax proposals. He wants to make those 2017 corporate tax cuts permanent, reduce capital gains taxes even more, maybe even introduce a consumption tax. All those things, they line up perfectly with the ideas in Project 2025.
So it's like a multi-pronged approach. Cuts from Congress, changes to the tax code, all pushing in the same direction.
Exactly. It's all about shrinking the size and scope of the federal government.
And then there's that whole thing about Elon Musk heading up the Department of Government Efficiency. What's that all about?
That's one of the most interesting parts of the analysis.
I have to say it caught my eye too.
It was pretty wild. So they're proposing this new department, DOGE, Department of Government Efficiency, and they want to put Elon Musk in charge. And from what we've seen, he's taking a pretty aggressive approach to cutting costs.
Like what?
Well, he's reportedly fired thousands of federal workers and canceled billions of dollars in government contracts.
Wow.
It's been pretty controversial, with some folks raising legal and ethical concerns, but House Republicans, they've mostly backed him up. They say it's necessary to clean up the waste and corruption in the government. So it seems like this push for efficiency, for cutting costs, it's a big part of their vision for a second Trump term. And it aligns pretty well with those proposed congressional cuts we've been talking about.
So it all fits together like a puzzle.
Exactly. And it's a puzzle with some pretty high stakes, especially for Californians.
Okay, so we've covered a lot of ground here today. We've gone deep into the weeds.
Deep dive.
But let's bring it back to our listeners.
Mm-hmm.
What would you say is the most important takeaway from all of this? What should people in California really be paying attention to?
I think the California Budget and Policy Center sums it up best. These proposed cuts, they have the potential to really shake things up in California.
Okay.
We could be talking about huge reductions in federal funding, the kind of cuts that could affect a whole bunch of programs that Californians rely on every single day.
From healthcare to education to housing, the whole 9 yards.
Exactly. And it's not just about the programs themselves, it's about the people who depend on them. We're talking millions of Californians, our friends, our families, our neighbors.
So it's personal.
It is. And while we have a general idea of the areas that could be affected, there's still a lot we don't know.
Like what?
Well, the negotiations in Congress are still ongoing, so the final outcome is still up in the air.
Right.
And even if we knew exactly what was going to be cut, it's hard to predict exactly how those cuts would play out here in California.
So there's a lot of uncertainty.
A lot of uncertainty. But one thing's for sure, the potential impact is huge. We're talking about billions of dollars less in federal funding, potentially millions of Californians losing access to vital programs. This is something we all need to be paying attention to.
So, as we wrap up this deep dive, here's a thought for our listeners to chew on. Given the potential for these cuts to have such a widespread impact here in California, what are the aspects that are most important for you to think about? What are the questions you want to explore? Maybe take some time to look into how these proposed cuts could affect the services or the people you care about most in our state. It's an issue that could touch all of us in some way.
Yeah, it's worth thinking about.
It is. And we'll keep you updated on this as things develop. Thanks for listening.
Thanks for having me.